All the best, Pa. 20 batch, those who are participating today. All the other students also watching, Illa.
Yes, ma'am.
Okay, Ma. All the best, Ma.
Thank you so much, ma'am.
Thank you.
So with all the wishes from the assistant professors, Dr. Brooklyn ma'am, Dr. Vahini ma'am, Dr. Shivaranjani ma'am, and Dr. Taslima ma'am, now we are starting with the semifinals. Yes, so be ready, guys. Jeopardy is on the way.
Can you all hear me?
Yes,
Yes. Yep. All right. So, welcome to Galenoquest'21 Semifinals. Before we get to the rounds, I'd like to have some team introductions. So, first, Med Zeppelin. Devika, can you please introduce our team?
Good afternoon. My name is Devika Menon, and these are my teammates Lakshya L and Veerashakti V, and we team one Med Zeppelin.
Team 2, Kota Hepatis.
Good afternoon, everyone. My name is Keetna J. Our teammates are Keetna R and Aditesh Tripathi.
Super Scrubs.
Sorry to interrupt.
Yep. Yes, ma'am.
Can I have a request here? For those funny names, can we have for funny team names? Can we have an explanation for why they chose the name? Also, along with the introduction.
Sure.
I will like taking much of your time.
No problem. We can do it, ma'am. Med Zeppelin. Med Zeppelin.
It's like a band called Led Zeppelin, and we made a pun out of it, which is like Med Zeppelin. That's what.
Okay. Kota Hepatis.
Nothing. So that's a triad. So 3 of them in the team. So we got that.
Super Scrubs.
Hello everyone, I'm Sri Raksha, and these are my teammates Srinapriya and Vashantra. So we are the Super Scrubs. We mainly chose the name because it sounded very quirky and fun.
All right. Team 4, the Craving Cremasters.
Hi everyone, I'm Janapriya and my teammates are Kaushika and Kritika. We chose this name Craving to Masters because we wanted to be the masters of this show and we are craving for success. So the Craving to Masters.
Thanks. Humorous guys.
So hello everyone, we are the Humorous guys. The team consists of me, Deepak, Manasi and Japinder. So the name Humorous guys is actually a pun on the word humorous. That's
Smarticus.
Hello everyone, we are Team 6, the Smarticus, myself Akshya, and our team members are Darshana and Lavanya. We just choose this name because something related to anatomy, like which ends with the cuss and everything. It's more of fun. Like we just chose, we want to be smart, like that's what.
All right. Team 7, Trios Abdominis.
Hi everyone, this is Harshavardhini and my teammates are Joshni and Savita. We chose the name because we are 3 and we are doing a quiz about the abdomen. So,
Right. Team 8, the Triumphant Triad.
Good evening, everyone. I'm Hamrish Kumar Rajkumar, the team captain, and my teammates are Mr. Srinivas Rachori and Ms. Kavya Balaji. We chose this name because we are 3 members that explains triad, and we want to triumph in this quiz. So, triumphant triumph.
Cool. So now we are moving on to the quiz. Are you all ready? Hello?
Yes, Kushmaster.
Yes,
All right.
sir.
All right. So before that, I want you to join the buzzer. The game code is 193586. Join your teams.
Quizmaster, can you repeat the code?
193586. There are only 19 people who joined the buzzer. Please join soon. We don't have a lot of time. All right, we're starting now. So first, the round is Jeopardy. Let's start with round one. Here is a randomizer. Now my batchmate Vinita will be sharing which team will go first. It's a random pick. Vinita, if you'd like to choose one team.
The Smarticus.
All right. So the Smarticus will be starting. Smarticus, are you ready?
Yes, Quizmaster.
All right. So which one do you want? The Smarticus.
Embryology, 20 points.
All right. So before I open the question, I would like to share the rules. So once the question is opened, you have 10 seconds to buzz. Any team can buzz in. The team which buzzes in first, they get to answer. If you answer it wrong, you'll get negative points. That is, if the question carries 20 points, you'll get negative 20. If you answer it right, then you'll get 20 points. If you don't answer, you get 0. If you answer wrong or if you don't answer, the question passes on to the next team who has buzzed in next. Make sense? Can we start? Yes?
Yes, Kushmaster.
All right. So the question is, the membranous part of urethra develops from which part of the urogenital sinus? And your time starts now. Med Zeppelin.
So the pelvic part of urogenital sinus.
That is absolutely right. So you get 20 points. So you get to choose next. Which one do you want?
So we're going for spotters, 20 points.
Spotters, 20 points. Here you go. So you have to identify the number 3 in this. And here is number 3. And your time starts now. The triumphant triad.
Genitofemoral nerve.
Sorry, that's the wrong answer. You lose 20 points. The next team is humerus, guys.
Iliohypogastric.
Is it the iliohypogastric nerve?
That is correct. You get 20 points. So now, which one do you want?
We'll go for pathology, 20 points.
All right. Pathology, 20 points. Here you go. Name the longitudinal mucosal tears near the gastroesophageal junction and are often associated with severe vomiting. And your time starts now. Porta hepatis.
Mallory-Weiss tear.
That is absolutely right. You get 20 points. So what do you want next?
Pathology, 40 points.
All right, pathology, 40 points. Here you go. Name the causative organism of pseudomembranous colitis. And your time starts now. The humorous guys.
Is it Clostridium difficile?
That is absolutely right. You get 40 points. Well done. What do you want next?
We'll go for spotters, 40 points.
Ooh. Spotters for 40 points. Here you go. You have to identify the number 18 and your time starts now. It's here. The number 18 is here. The humorous guys.
Is it uterus?
That's wrong. You lose 40 points. So the next team, Super Scrubs.
Sir, is it the cortex?
Can you be more specific? Yes, Super Scrubs.
The lateral cortex?
No, that's wrong. You lose 40 points. Next, Med Zeppelin.
Posterior fornix.
That is absolutely right. You get 20 points. 40 points, sorry. So what do you want next?
Embryology for 40 points, sir.
Right? Embryology for 40 points. Here you go. At birth, a baby girl has meconium in the vagina and no anal opening. What type of birth defect does she have? Your time starts now. The triumphant triad.
Sir, imperforated anus, sir. So there is a fistula between the rectum and the vagina, sir.
That is absolutely right. You get 40 points. What do you want next? The triumphant triad.
Histology for 20 points, Quizmaster.
Right. Histology for 20 points. Here you go. Identify the given slide. Your time starts now. Super Scrubs.
Sir, it's the appendix.
Sorry, could you please repeat it?
It's the appendix.
Be more specific.
The appendix orifice. The appendix, sir.
All right, I'll accept it. I'll accept it. It's the vermiform appendix. You get 20 points. What do you want next? Before we go to that, I'd like to add that there is a hidden image behind this grid. The team which identifies it first will get a surprise amount of points. So, Super Scrubs, what do you want next?
Histology, 40 points.
Histology, 40 points. Fan of the microscope, huh? So identify the given slide. What is it? The time starts now. Porta hepatis.
That was accidentally buzzed, sorry.
No, that will not be accepted. You will lose 40 points. Any other team? Super Scrubs. Super Scrubs.
Sir, is it the secondary follicle?
That is absolutely right. You get 40 points. Congratulations. What do you want next? Super Scrubs, what do you want next?
I'm still 60, sir.
Nice.
Master.
Feeling fancy, huh? Name the glycoprotein produced by the epithelium of thick ascending limb that prevents infection and formation of calculi in the renal tubules. Your time starts now. Porta hepatis. Porta hepatis. Your time's up.
Sir, sorry, I took first unknowingly. Sorry.
If you accidentally press, you will get negative points.
I will just having sorry.
Miss Master, can we answer it?
Sorry?
Can we answer it? Like we didn't bus.
Okay, sure. What team are you?
Super Scrubs.
Okay, go ahead.
Tom Harswell proteins.
Congratulations, that is absolutely right. You get 60 points. What do you want next?
Histology 80.
Nice. Name the cells that are specialized as antigen transport cell. They cover the lymphatic nodule in the lamina propria.
They cover the lymphatic.
Your time starts now. The triumphant try.
Microfold cells or the M cells?
That is absolutely right. You get 80 points. Congratulations. Triumphant try. Can you please elaborate on the M cells?
So M cells are present they're basically modified epithelial cells that are present over the Peyer's patches or lymphoid follicles present under. They're called so because they have small microfolds and they help to take the antigen and present it to the lymphoid follicles below for antibody production.
Nice.
So they're antigen presenting cells.
Excellent. So which question do you want next?
Tubes and instruments for 20 points, Quizmaster.
All right, here you go. And your time starts now. Identify this instrument. Humerus, guys.
Is it artery forceps?
That is absolutely right. You get 20 points. What do you want next?
Pathology 60 points.
Pathology 60 points. Here you go. Name the clinical condition in which the hepatic veins of the liver are obstructed by blood clots. Your time starts now. The triumphant try.
Budd-Chiari syndrome.
That's absolutely right. You get 60 points. Can you please explain about Budd-Chiari syndrome?
So normally the hepatic artery as well as the portal vein takes blood to the liver, and hepatic veins drain it. But normally when there is an obstruction of the hepatic vein, that means there is the blood flow cannot happen. So there will be associated hypertension along with since the blood backflows into the sinusoids, there will be damage to the hepatocytes.
Excellent. So what do you want next? The triumphant try.
Spotters for 60.
Spotters for 60. All right, here you go. Identify number 49 in the given slide. All right, your time starts now.
Quizmaster, we are not able to see 49. Could you please point?
Yeah, 1 second. All right, I'm resetting the timer. You can again try it. No takers? No one wants to try it? All right. I won't be deducting any points. Do you want to guess? Take a guess. Any team? Anyone?
Sir, is it Jennifer Cameron now?
No.
Sir, is it ileoid hypogastric, sir?
No. All right. The audience watching it live on YouTube can try it, and please leave your answers in the comments section. We'll look through it and we'll announce them later. So the answer to this question is the right testicular vein. Since no one answered, I'm going to choose the team at random, and they'll be starting it now.
Sir, sorry for the interruption. Is that the scientist Rudolf Virchow, sir?
No, you're wrong.
Okay, sir.
All right. So Med Zeppelin. What do you want?
So, embryology for 60 points.
Embryology for 60 points. All right. Here you go. I am from septum transversum. I make the prospective liver endoderm to respond to my friend from cardiac mesoderm. Who am I? Your time starts now. Med Zeppelin.
Ductus venosus.
No, you lose 60 points. No one has buzzed. Do you want to try it? Okay, anyone can try it. No points from now.
Sir, is it BMP?
That's correct. You could have buzzed in, but now you don't get any points. The triumphant try. Go again.
Pathology 80.
Pathology 80. Here you go. Which pituitary hormone is higher in Steen-Leventhal syndrome? Your time starts now. No one? Seriously? Anyone want to try it? Just try it. I won't be deducting any points if you get it wrong.
Sir, is it FSH because it is a part of polycystic ovary?
What you're saying is it is related to polycystic ovary syndrome, but it is not FSH.
Is it LH, sir?
Yes, it is LH. But you don't get any points. Sorry. Which team answered LH?
The craving remaster, sir.
Okay, go ahead. Choose another question.
Tubes and instruments 40 points, sir.
All right, tubes and instruments for 40 points. Here you go. Identify the given tube, and your time starts now. The humorous guys.
So is it Foley's catheter?
That's absolutely right. You get 40 points. What do you want next?
So Path 100.
Path 100. Studied Robin's power to go around. Name the acute ulcerative sexually transmitted infection caused by Haemophilus ducti. Your time starts now. Superstar.
கேட்கலையா? இது எங்கேயோ பார்த்த மாதிரி இருக்குது.
Can you please mute yourself? Thank you. Super Scrubs. What's your answer? Super Scrubs?
Can we not answer, quiz master?
All right, fine. That's up to
You
you.
won't get any points, right?
And they will.
No, we're not answering anything.
No points will be deducted. But since no one has buzzed in, do you want to try? Give it a try.
Okay, we just like two more trying. Is it
Yeah.
syphilis? Is it syphilis? No, it's no, right?
No, it's not syphilis. Yeah.
So this is photo apparatus, sir.
Mhm.
We also accidentally bust some but
We didn't get it.
we detected points for much, but we didn't answer the.
No, you said you accidentally buzzed. They said that they buzzed in, but they said they want to withdraw it.
Sir, then both the same winner, sir.
No, it's not. Your explanation is different. So, and the quizmaster's decision is final here.
Okay, fine, sir. Thank you, sir.
Anyone want to try it?
Sir, is it chancroid?
That's correct. Is it? It is chancroid. Which team answered it?
Sir, porta apparatus.
Won't be getting any points, but you get to choose which question you want next.
Spotters. Sorry, embryology 80.
Embryology 80.
Yeah.
All right, here you go. During the development of pancreas, the endocrine cell that expresses only PAX6 gets differentiated into which type of cell? The time starts now. Try subdominus.
Alpha.
That is absolutely right. You get 80 points. What do you want next?
Histology 100.
Histology 100. Interesting. Here you go. Name the cells in liver that store vitamin E. Your time starts now. Triumphant try.
Cytocells.
That is absolutely right. You get 100 points. What do you want next?
Embryology 100.
Embryology 100. Are you sure? Here you go.
Yes, quizmaster.
Name the syndrome in which there is a lack of androgen receptors or failure of tissues to respond to the receptor dihydrotestosterone complexes. Your time starts now. No one buzzed? Okay, so anyone want to try it? It's a straightforward answer. The answer lies in the question.
Or is it androgen insensitivity syndrome?
That's exactly what it is. You could have gotten 100 points, but you lost the chance.
Like, do we get the points, quizmaster?
No, you don't. But you get to choose which question you want to open next. Choose which question you want next. There are only 5 available.
Quizmaster's spotter is 80.
Spotters 80.
Yeah.
All right.
Quizmaster, could you highlight the number before starting the buzzer? Because there are too many numbers and we can't choose.
Sure.
Thank you.
Yeah. So here you go. And the timer starts now. No one buzzed? Hey, come on, this is a straightforward question. Do you want to try it? Come on, at least one of you try it, man.
So is it idioinguinal?
No.
Can we just try? Is it testicular?
No. Is it a vein or a nerve or an artery?
Artery?
No. It's a nerve. It's a nerve. It's the right genitofemoral nerve. Yes, your lack of dissection is catching up to you, I guess. Moving on.
Quizmaster, is the picture Hippocrates?
No, it's not.
Aristotle?
No.
Sir, is it Vesalius?
No. All right. So which team answered right the last time? Okay, since no one's asking, I'm going with a random team. Trios abdominis. Choose a question.
Tubes and instruments 60.
Tubes and instruments 60. Are you familiar with tubes? Here you go. And your timer starts now. Anyone want to try? Putting the Sorry for the interruption. We are continuing. Anyone want to try this? Any team? Hello? Okay, I'll give you a clue. This tube goes in through your mouth or nasal cavity.
Nasogastric tube?
That's correct. Do you have any other name for it? Okay,
No.
it's the Riles tube. Heard of it? All right, moving on. So, which team answered nasogastric tube?
Sir, is the big gallon?
Yes, that is correct. Which team is this?
Trios abdominis, sir.
You get 250 points. Okay. Which team answered nasogastric tube?
Triumphant triad.
Go next. There are only 3 questions left.
Spotters 100.
What is 100? Getting done with the dissection all, huh? All right, spotters for 100 points. Here you go. Identify 8. And your time starts now. Trios abdominis.
Seminal vesicle.
That is absolutely right. Wait. No, it's not. No, I won't accept it. So you lose 100 points. Time for try.
We withdraw.
Sorry?
We withdraw.
Wait, are you saying it? You're withdrawing?
Yes.
All right. Led Zeppelin?
So will we lose points if we answer this?
Can we try it? We didn't buzz, but we want to give it a try.
Wait, Led Zeppelin buzzed it.
Oh.
Will we lose points if we answer this incorrectly?
Yes, you will.
Okay. Should we withdraw? We withdraw, sir. We're not sure.
All right. Why don't you give it a try?
So we want to we didn't buzz, but we want to give it a try.
Sure.
Will we get points if we give the correct answer right now?
No, you won't.
Okay, is it ejaculated up?
You're close, but no.
Sir, vast difference.
Yes, it is vast difference. All right. Which team answered it?
Humorous guys.
Go ahead to the next one.
We'll do tubes 80s.
Right. Identify the given thing. Your time starts now. Smarticus.
Colostomy bag.
That is absolutely right. I'll accept it. You get 80 points. You have only one question left. Doesn't matter. So I'm just going to open it. And identify it. Your time starts now. No takers? Seriously? What hepatitis? Go ahead.
Sir, we
Sir,
withdraw.
can we try?
Wait. Porta hepatitis buzzed in. So.
Sir, we withdraw, sir.
Why? Okay, fine. So which team wanted to try?
Sir, Smarticus. Cytobrush. Some cytobrush-like thing which is used for that cervix. You're
right. You're close. You're close.
For pap smear?
Yes, it is used for pap smear. It is a cytobrush.
Pap smear, that cytobrush. They use it for that. Some
Scraping
liquid
of
also
the
they
cells.
use, like,
Yeah, that is correct. Is there any name for it?
I don't get the name, sir. Yeah.
Okay, it's fine. It's a cervical broom. All right.
May I interrupt here?
Yes.
Ms. Master, please pardon me.
Come.
I know your decision is final, but they were very close to identifying what it is. Except for the word broom, I think they got it right. Can they be pardoned?
But they didn't buzz in, ma'am, so we can't. They can't give points.
Okay. Thank you.
So with this, we are finishing round 1, and you get a break of 1 minute, followed by which we will let you know how many points you have, so that you can wager for your bonus question 1. All right.
Quizmaster, can we take a small break and switch off our cameras?
No. You will get a break after bonus question 1 gets over.
Okay, Quizmaster.
All right, so here are the scores. Med Zeppelin, you're at 0. Water Hepatis, minus 80. Super Scrubs, 120. Craving Cremasters, 0. Humorous Guys, 60. Smarticus, 80. Trios Abdominus, 230. Triumphant Triad, 260. So now we are going to the bonus question where you can wager your points. So this is your bonus question. You get 2 minutes to wager your points and your answer. You have to DM me personally. The team captain should do it. And you have 2 minutes for this. After you have wagered, you get a 2-minute break. All right, the slide has been closed. You get a 2-minute break now. Team captain, send your answer and your wager.
Quizmaster, could you show the slide again, if possible?
Sir, what's the Quizmaster? What's the maximum we can wager?
Whatever you have.
Quizmaster, we have to text the answer to you, right?
That is correct. Super Scrubs is getting 120 points. I got it right. Trios Abdominus. Can you be more specific with your answer? The team captain, please answer your DM me with your specific answer. Okay, since I didn't get any question, your answer is partially right. Okay, you gave the full answer, so I'll give you 100 points. The team is Trios Abdominus, Team 7. Smarticus, Can you be more specific? You have only partially answered. Smarticus, are you going to change your answer? All right, since you are not answering and your answer is partially right, out of the 10 points you wagered, I'll give you 5. The Smarticus. The triumphant triad. Your answer is partially right. Can you be more specific or? Okay, you're typing. All right, 260 points. The triumphant triad. Okay, that's all the wages that I got. So I think we can move on with the next one. The answer is Alcian Blue and Van Giesenstein. Before we move on to round 2, there is a special announcement.
Sir, you have already in the answer you have given Alcian Blue, and that's what I have deemed you. So is it
You have to
not
mention both of them.
both the you require both the answers?
Yep. Yep.
Okay. Thank you.
So do you remember what happened last night?
Treasure hunt, Quizmaster?
Yes. And how was it? Anyone want to take it up? Was it difficult? Was it easy? How was the experience?
Difficult.
Quizmaster, I really wanted to know who had the idea of jumbling up the words. That was what led to us like trying out each letter of the alphabet.
Actually, we even mentioned that you have to rearrange the letters there. So it's your fault of
We
not
didn't
reading.
notice it for the first one.
Quizmaster,
But for
the same thing you gave have 2 names, so we had a difficult time in choosing which one you might have thought.
Alphonse and Pudendal Kemal. Those 2 are words which
That's a trick there. Because if we only give you one answer, then what's the point of being it a hunt? So we are going to announce the results of Treasure Hunt right now. How many points do you think it was for? Any guesses? Amrish, do you want to go?
200 points or 300 maximum.
Okay. You're just a bit off. And by a bit, I mean 10 times. So here are the results. Led Zeppelin, who finished first, gets 2,000 points. Super Scrubs, who finished second or didn't finish and answered most of the questions, gets 1,750. The Humorous Guys get 1,500. Triumphant Triads, 1,250. Porta Hepatis, 1,000. Craving Cremasters, 750. Smarticus, 500. Trios Abdominis, 250. So, what do you So, what do you think of the points? Led Zeppelin.
Thank you, Quizmaster.
Did you expect this much points?
We did not.
Super Scrubs?
Quizmaster, we thought maximum it will be 500 or 1,000 maximum. But this is a little over the edge, but we're happy.
Don't you think these points are valid for the level of difficulty that you faced last night?
Definitely.
I mean,
It's
you,
another.
sir, more than the difficulty, the time put in, sir. 5 hours.
Yeah, true. Almost 4.5 hours you had worked on that. So don't you think you deserve these much points? All right. So can we move on now? Yeah.
Quizmaster, can we have a 5-minute break?
I just gave you a 2-minute break.
Okay.
So after Jeopardy, you'll have a 5-minute break. All right. So moving on to round 2 of Jeopardy.
Quizmaster, just 1 second. Our teammate has lost her connection. Just a minute, please.
Has Kavya joined?
She's continuing to face the issues, Quizmaster.
How long do you want?
Can she join in the middle? Can we proceed with the round and can she join in the middle?
If that's okay with your team, then that's fine.
Just a second.
Can we move on?
Quizmaster, she has lost her broadband connection, so she's trying to change over to data. So could we get 5 minutes with failing to which you can continue with the quiz proceeding.
I can give you only 1 to 2 minutes, more, not more than that. All right, take 2-minute break, everyone. We'll start after 2 minutes.
Thank you, Quizmaster.
Quizmaster, I'm really sorry for the inconvenience.
All right, we are moving on with round 2. So, Led Zeppelin, go ahead. Can you all hear me?
Yes, Chris Master.
Okay, Led Zeppelin, go ahead. Choose the topic.
Science for 40 points, sir.
Science for 40 points.
Yes, we can. Okay.
All right, here you go. Referred pain to the left shoulder due to the presence of blood or other irritants in the peritoneal cavity when a person is lying down and the legs are elevated. What sign is this? Your time starts now. Led Zeppelin?
Sir, is it Kerr sign?
That is absolutely right. You get 40 points. Choose another topic.
Sir, radiology for 40 points, sir.
Radiology for 40 points. Right. Here you go. What type of radiograph is given below where biconjugate uterus is depicted? And your time starts now. Led Zeppelin?
Is it a uteropylogram?
No, it's not. You lose 40 points. No one buzzed in. No one wants to try.
So can we try?
Sure.
No negative marks, right?
No.
So is it hysterosalpingogram?
That is absolutely right. But you don't get any points. Which team is this?
Humorous guys, sir.
Go ahead. Choose another topic.
We'll go for surgery, 80 points.
Surgery, 80 points.
Yeah.
Jumping the first step. What is this diameter? Your time starts now. Super Scrubs.
It's the anterior posterior diameter of the pelvic inlet.
How do you measure it?
Sir, I just know the diameter of it, but I don't know how to measure it and all.
All right, I will accept it, and you get 80 points. Choose another topic.
Sir, Quizmaster 80 science.
Science 80. All right, here you go. The examiner locates the point of maximal tenderness through palpation of the abdomen in the usual manner with the patient's abdominal muscles relaxed. Then asks the patient to tense their abdominal muscles by lifting their head up from the pillow, let's say, and applies pressure to the same point and checks the level of pain. So what's this sign known as? Your time starts now. Okay, no one buzzed. Anyone want to try?
We would like to try Carnet sign.
That is absolutely right, but you don't get any points since you didn't buzz. Sorry. I'm really sorry, but I think the order is messed up. All right, fine. We'll go ahead. So which team wants to, which team answered now?
Triumphant triad.
Okay, go ahead. Choose another topic.
We would like to choose surgery for 40.
Surgery for 40. All right. Here you go. Surgical treatment of congenital hypertrophic pyloric stenosis is what? Your time starts now. The humorous guys.
Sir, Ramstead pyloromyotomy.
That is absolutely right. You get 40 points. So what do you want to go next?
So, histopathology 40.
Histopathology 40. Have you read Robbins?
Yeah.
All right, we'll see. In which condition is the following slide stained with Prussian blue is seen? Your time starts now. Super Scrubs. Super Scrubs.
Quizmaster, is it Wilson disease of liver?
No, it's not. You lose 40 points. Anyone else wants to try it?
So, is it a hemochromatosis of liver?
That is absolutely right. But you don't get any points since you didn't buzz. Which team is this?
Humorous guys.
All right, go ahead. What do you want next?
Okay. Surgery 120, sir.
Surgery 120. Have you read all the books that we gave for reference?
Somewhat.
Okay, fenestrial incision is done for what? Your time starts now. Smarticus.
Like the pelvis thing for the any, it's like suprapubic region.
That's
that
correct.
incision is done suprapubic region for any like recta therina.
Can you give me an example of any surgery?
Any surgery like any like hysterectomy like that, removal of uterus or something like that.
I will accept it since you gave a perfect explanation. So you get 120 points. The Smarticus gets 120 points. What do you want next?
Science 120 points.
Science 120 points. Since there is a problem with the presentation, I'd like to stop it before I open that. So hold on for 1 second. All right, we are back. So science for 80. I'm sorry, the 80 and 120 are swapped. Since the 120 was already open, you get to see the 80-point question right now. So the patient lies on a couch. The examiner gently stretches the right spermatic cord using the thumb and index finger right above the testis in the right scrotum. For a patient with appendicitis, this causes pain in the right iliac fossa. What is this sign? Your time starts now. Med Zeppelin.
Sir, is it 10 horn sign?
That is absolutely right. You get 80 points. The Med Zeppelin gets 80 points. Go ahead. Choose another one.
Radiology. Okay. Sure.
Radiology for 80 points, sir.
All right. Radiology for 80 points. Another dark, huh? The given radiograph depicts sawtooth sign, which is seen in which condition? Your time starts now. No one? Anyone want to try it?
Sir, we want to actually.
Is
it diverticulosis of colon? Can we wage points for it now, sir?
No, you cannot. You cannot wage points for it now.
Diverticulosis of.
It is colonic diverticuli. It is. But since you didn't buzz, you won't be getting any points. Sorry. Which team was that?
Super Scrubs, sir.
Okay, go ahead. Choose another topic.
Histopathology 80? Sure. Histopathology 80, Quizmaster.
All right. Histopathology for 80. In which condition is the given slide of colon seen? Your time starts now. No one buzzed. Anyone want to give it a try?
Sir, is it
Mhm.
bronze?
No, it's not.
Is it ulcerative colitis?
No, it's not.
Is it a polyp?
Yes, it is. It is a polyp. Do you want to give it a try as to what exact polyp it is? Or like what?
FAP?
Yes, it is FAP. Exactly, it is FAP. Which team was that?
Smarticus.
How do you identify that it's FAP?
Like, I just guessed it.
All right, but still you don't get any points since you didn't buzz. So choose another topic.
Science, 160 points.
Science for 160 points. Here you go. Hyperesthesia felt by the patient to light touch in the right lower scapular region or the right upper quadrant of the abdomen. What is this sign? Your time starts now. Smarticus.
OR sign?
That is absolutely right. You get 160 points. Are you familiar with this question? Have you seen this question before?
Like, I have seen this before, but I'm not. It was a guess actually.
Wasn't this exact sign given in your anatomy abdomen IA essay?
Referred pain for cholecystitis.
Exactly. All right. So which team answered it? Which team answered it?
Radiology for 120.
All right. Radiology for 120 points. Here you go. The given radiograph depicts handshake sign, which is in which condition? Your time starts now. The humorous guys.
Sir, horseshoe shape kidney.
That is absolutely right. You guys can give handshake to each other now. Which question do you want next?
Sir, is that Vesalius in the background?
Sorry?
Is that Vesalius in the background?
Yes, it is. Which team is this?
Med Zeppelin, sir.
Med Zeppelin, you get 250 points for guessing the picture right. So the humorous guys, go ahead. What do you want next?
Surgery 160.
Surgery 160. All right. Position for laparoscopic cholecystectomy is what? Your time starts now. The humorous guys.
Is it half jackknife position?
No, it's not. That was for the adrenals and it was in your prelims paper. Craving remasters.
Reverse
Actually,
Trendelenburg
the
sign.
humorous guys, you lose points. Humorous guys, you lose 160 points. And I forgot to mention it. Now, craving remasters. What's your answer?
Reverse Trendelenburg sign, sir.
Trendelenburg position. Can you tell me which side should be up?
For Trendelenburg, the head should be down. So for reverse Trendelenburg, the head should be up.
Yeah, which side?
Supine position.
Which side should be up?
Right side, sir.
Right side is the final answer. Are you sure?
Oh, which side up?
Yeah. Is right side your final answer?
No, sir, we are not sure.
Okay. Do you want to change it? If you don't change it, then I'll take right as your final answer. All right, since you're not answering, I'm going to take right side up as your final answer. Do you think it's right or wrong?
No idea, sir.
It is right, and you get 160 points.
Thank you, sir.
Moving on. Choose the next topic. Choose the next topic.
Sir, radiology 160.
All right. Radiology for 160. Here you go. The given radiograph shows cartwheel appearance, which is seen in which condition? Your time starts now. No one? Super Scrubs. Go ahead.
Is it some
Quizmaster?
Is it
Quizmaster, is this some heighted?
Wait, is this a Super Scrub answering?
Yes, is it hydrated Quizmaster?
Highlighted what? Completed.
Okay. Is it the liver hydrated or hepatic hydrated?
It is the hepatic highlighted. So you get 160 points. So Super Scrubs gets 160 points. And moving on. So what do you want next?
Quizmaster, we want the 200 signs.
200 for science.
Yes.
Did you get any sign to choose that question? Murmur heard over the umbilicus, often with the presence of caput medusae. It is seen in what sign? Your timer starts now. No one? No one wants to try? Led Zeppelin, Triumphant Triad, Smarticus, Super Scrubs. No one wants to try? See,
Sir,
yeah.
is it cable murmur sign?
No, it's not. Anyone else? Okay, I'll move on to the answer then. It's Cruvelia Baumgarten sign. Go ahead and read up about it. Okay. So now, the humorous guys. Do you want to go next?
So histopathology 120 points.
Histopathology for 120 points. I think you really favor histopathology. In which condition is the given slide of prostate seen? Your timer starts now. Okay, come on, guys. It's an easy question. Pathology condition of prostate. Anyone want to try it? No one bust. Just give something. Give me a try. Give it a try.
Is it BPH?
BPH.
It's not BPH.
Is it carcinoma of prostate?
Yeah, what's the carcinoma of glands called as?
Adenoma, something like that.
Yeah, it's adenocarcinoma of prostate. So since you didn't buzz in, you don't get any points. So sucks. Which group was that? Which team?
Super Scrubs.
All right, go ahead. Choose the next one.
Quizmaster, we want radiology for 200 points.
Radiology for 200 points. No one wants the scopes. The given radiograph depicts drooping lily sign, which is seen in which condition? Your timer starts now. Humorous guys.
So double pelvis.
No, you lose 200 points. The triumphant triad. Wait, the humorous guys. Double pelvis as in, can you elaborate on that?
Sir, duplication system, drooping lily sign is seen in double pelvis. That's all I know, sir.
Double pelvis? What
shows
pelvis?
drooping renal pelvis, sir.
You didn't mention that.
Okay, sorry, sir. Renal pelvis.
Can you be more specific?
More specific than renal pelvis?
Yeah.
No, sir.
All right, then you still lose 200 then. The
Sir,
triumphant triad. Triumphant triad. Are you there?
We withdraw.
Superscripts.
Duplex pelvic-calcium syndrome.
Duplex pelvic syndrome. Can you tell me which system is abstracted, or what is duplexed here?
So the ureter.
More broader term.
More broader.
Just the ureter is duplexed, or what? You said pelvic duplex. Now you're saying it's the ureter that is duplexed.
Pelvic-calcium systems. Duplex pelvic-calcium systems. Quizmaster.
Okay. Portal hepatitis, do you have a better answer?
I just know the double
Can we guess? Can we give a try?
Wait, hold on. Since the three teams, the humorous guys, Super Scrubs, and Porta Hepatis, they gave almost almost right answers. I'll give them half points. And humorous guys, your negative points has been revoked. So
Thanks a lot, sir.
all three of you get 100 points instead of the 200. So does anyone want to try it?
Duplex collecting system.
Yeah, it's a duplex collecting system. Which of them is abstracted here?
The ureter.
Which ureter?
So
The
left
distal
ureter.
part.
Huh? Sorry?
Distal ureter.
It's the upper part. See, the drooping lily sign is seen here because the upper part has been abstracted.
What?
The drooping lily sign is seen because the upper part is abstracted. You only get the lower part. So yeah, that's it. Moving on. So the humorous guys, choose the next question.
Surgery 200.
Surgery for 200. Why does no one know the scopes? Management of gastro cases is if it is too large to be clear. How will you do it? Your timer starts now. No one buzzed in. So anyone want to try it?
Sir, is it Ramirez separation technique or something?
Not really. Any other try? All right. It's by creation of a silo and then a gradual reduction of the abdominal contents. You can read about it in Balian law. So moving on. The humorous guys tried it, right?
Yes, sir. Yes.
Go ahead. Choose another one.
So histopath 160.
Histopath 116. All right, here you go. In which condition will the given immunofluorescence pattern be seen? The timer starts now. Super Scrubs.
Sir, amyloidosis.
No.
Amyloidosis.
No. You lose 160 points. Humorous guys.
Sir, post-streptococcal glomerulonephritis.
No. You lose 160 points. Who wanted to try?
Marticus.
Yeah, go ahead, try it. But you don't get any points.
Pasture syndrome.
No, it's not good pasture. You don't lose points. You don't get points. Anyone else wants to try?
So glomerulonephritis.
It's actually the glomerulus, but be more specific. It's not glomerulonephritis.
Sir, is it the membranoproliferative glomerulonephritis?
Close. It's the IgA nephropathy. So moving on. Smarticus, go ahead with the next one.
Histopathology, 200 points.
Why no one wants the scopes? Why do you hate the scopes or something? In which condition is the given in situ hybridization slide of cervix seen? Your time starts now. Smarticus.
CIN.
Find it.
Cervical intraepithelial neoplasia.
No, it's not the answer. You lose
Because
200.
That's actually the DNA. That is the HPV virus DNA is actually upregulated. That
Yeah,
thing.
it's the human papillomavirus infection, but
Yeah,
still.
HPV DNA is being like coilocytosis. DNA is getting.
It's getting what?
Like
Okay, if you answer it,
more,
I'll give you partial points.
That's actually the same for HPV DNA, which is getting replicated more in that cervix intraepithelial neoplasia.
Correct. Okay.
It's whether we should find whether it is a DNA or RNA. We do that staining in that slide.
All right. You explained it perfectly, so I'm going to give you 200 points. Just because you gave this good explanation, I'm giving you 200 points. Else, I won't be doing it. So, go ahead. Choose the next topic.
Scopes 40.
All right. Scopes for 40. Here you go. Identify 12 in the laparoscopic view. Your timer starts now. No one buzzed in. Hey, come on, give it a try.
We would like to try.
Yeah.
It is the infundibulopelvic ligament, is it?
No.
Round ligament.
Yes. It's a round ligament. All right. So the time for try. Go ahead.
80 scope.
All right. You have no choice. Identify 6 in the given laparoscopic view. Your time starts now. No one wants to try it.
Master, is it liver?
It's the liver, but you don't get any points since you didn't buzz. So go ahead, choose the next one.
120 scopes.
All right. Identify 8 in the laparoscopic view. Your timer starts now. Smarticus.
It's spleen.
Yes, that is absolutely right. You get 120 points. The Smarticus. So choose the next.
Points.
All right. So in the given image is seen Trichomonas vaginalis infection. What is it known as? Your timer starts now. The humorous guys.
So is it cherry strawberry cervix?
It is the strawberry cervix. I'll accept that answer. So you get 160 points. The humorous guys gets 160 points. So moving on. That's the final question. Doesn't matter who chooses it. So what condition is seen in the given endoscopic view? Your timer starts now. The humorous guys.
So watermelon stomach, the condition is GAVE.
Wow, I'm impressed. That's absolutely right. You get 200 points for that. So with this, round 2 of Jeopardy gets over. Now we have a 1-minute break followed by which I'll announce all the points. After which you'll have the bonus question 2, followed by a 5-minute break. All right?
Quizmaster,
Yes, ma'am.
Swaminath,
Yes.
This is Sivaranjani Ma, just a suggestion.
Yes, ma'am.
That drooping lily sign question was there, right?
Yes, ma'am.
In that, the duplicate collecting system, the first team actually released out the answer as double pelvis, right? After that, the second and third team were following up with the same answers. So I feel that even if you give half marks, only the first team should get it. The second and third team is there. I hope they'll not be angry with me.
Yeah, no, Shivaranjani, I also completely agree with you because I also had the same thought because they actually gave away the answer almost.
Yes.
That's what. But we will leave it to the quiz master.
Final answers and all.
All right, ma'am. We'll discuss it and we'll let everyone know after the break.
Okay. Thank you.
You can give both the marks, both the team by equal marks, half of marks.
Okay, ma'am.
You think and tell.
Okay, so we considered that, and only the humorous guys will be getting 100 points, and the other two teams won't be getting that 100 points. So moving on, I'm going to announce the scores now. Med Zeppelin, you're at 2,330 points. Porta Hepatis, you have 920 points. Super Scrubs, you have 2,030 points. Craving Cremasters, you have 910 points. The Humorous Guys, you have 1,860 points. Smarticus, you have 770 points. Trios Abdominis, you have 580 points. Triumphant Triad, you have 1,810 points. So now we are moving on to the wagering part. You can wager whatever you have. So here is your bonus question number 2. After this, you'll be having a 5-minute break. So here is a question. Again, there's 2 minutes for this. You have to DM me with your team name, answer, and your points. We'll be announcing it after the 2 minutes. All right. So now here's your question. Identify G in the image. The G is the secretion of the cell. I have given you a clue. G is the secretion of the cell. It's not the cell. So your time starts now. You have 2 minutes. The slide is being closed now. All right, the wagers are done, and we are going to announce the results. Hamrish, you have wagered all your points. Are you that confident with your answer?
I saw it today morning, so I was like pretty sure of my answer.
All right, so you get 1,810 points as bonus. And Super Scrubs, How confident are you with your answer?
I saw it today
So we
morning
know
only. It was
it's cells, but we don't know if it's like we're not very confident, but let's see.
You have waited so much points for that. Are you
So,
confident?
but I'm like sure it's G cells. I don't know what
And gas
gas in the second base is. I mean, is it correct one? I mean, Quizmaster.
We saw.
So what will happen if that was wrong?
Then we'll probably just be depressed for the next quiz.
That is correct, and you get 2,000 points. Janapriya.
We are right?
Yeah, you are right. You get 2,000 points. So, Janapriya, you are wrong, and you are safe with betting only 10 points, so you only lose 10 points.
Okay.
And Med Zeppelin, your answer is right, but you have aged very less. You could have been more confident with your answer. So you get only 200 points. All right. So now you have a 5-minute break. So we'll gather back at 6:43. Sorry, I forgot to mention Trios Abdominis also got it right, and they get 300 points. Sorry about that.
That's it.